It is mostly disease of the females and rare in the male. It arises from the tissue of the breast, from lactating glands and milk-carrying ducts. So it is called as lobular carcinoma, which may be invasive or non-invasive, ductal carcinoma, which may be invasive or non-invasive. Mostly about 85% carcinoma belongs to the ductal carcinoma. Etiology. There is gene mutation in the DNA of the cells of the breast. Mostly it happens after the age of 40 years, near menopause, but it may be found in young girls due to traumatic injury to the chest or due to mishandling of the breast by multi sex partners, which pinches rashly and damage the tissue of the breast, which leads to the changes or mutation in the DNA of the cells and causes the carcinoma of the breast. Excessive use of alcohol, obesity, familial predisposition to carcinoma, exposure to the radiation by process of radiotherapy. These are the main factors which leads to the formation of breast carcinoma. Grades of the carcinoma. First grade is called as carcinoma in situ, when the cancer cells are limited to the inside of the ducts or the within the mammary glands or the milk produces glands, that is the lobules. Second degree, the cancer cells grow and invade the connective tissue, lymph nodes within the breast mass. At grade 3, these cancerous cells proliferate, proliferate and invade the chest wall and the outer overlying skin. Fourth one is metastatic stage. At this stage, the cancer cells invades the lymphatic and the blood streams. It causes the distant organs the metastatic cancer. The cells of the cancer passes in pieces to the lungs, bone, liver and brain and produces the secondary carcinoma and the related symptomatology. Symptoms of the cervical carcinoma. Painful lump formation in the mass of the breast, dimpling of the skin, discoloration of the skin, especially of the areola around the nipple, and the excretion of the abnormal fluid through the nipple. Symptoms of the carcinoma. In addition to these basic symptoms, the metastatic cancer also produces the related symptoms in the patient. When it approaches and causes secondary carcinoma in lungs, then there is cough, which is blood-stained phlegm, chest pain, breathlessness, and that may lead to the pneumonia and the pleural effusion, fever and pain. It passes and produces carcinoma in liver, leads to the loss of appetite, loss of weight, anorexia or cachexia, malaise, and jaundice. When it resides in the bone tissues, produces weakening of the bone, arthralgia, myalgia, frequent fracture of the bones due to the weak bones by the cancer tissues. When it is producing secondaries in the brain tissue, it produces neurological symptoms. There is diminished reflexes of the auditory system, visual system, memory system, and the neurological, the sensory and the motor nerve conductions, which produces the overall body weakness. And this coordination between the impulses and the response of the muscle, leading to the delirium, hallucination, seizure, and fits, leading to coma, and finally the fatality increases. Diagnosis of the cervical carcinoma: physical examination by manual palpation of the breast to detect the size, location of the lump. This can be performed by the patient himself or herself or by the healthcare provider. MRI: detailed study of the cancerous tissues, their growth, their location, their size, their types by the MIR waves, magnetic waves, and the energy waves. CT scan, mammogram. Mammogram is also performed by the X-ray radiations. It also is helpful to detect the details of the cancerous growth. Then there is a surgical procedure, that is needle biopsy. The suspected piece of tissue is extracted from the breast and is sent to the laboratory for histological study. Here we can detect the types of the carcinoma, whether it is ductal carcinoma, whether it is lobular carcinoma. Treatment of the cervical carcinoma: medical treatment, chemotherapy, targeted therapy, immune therapy, hormone therapy. Hormone therapy: when the cancer tissues are ER positive and PR positive, then there is scope for the hormone therapy and is beneficial at this stage. But in triple negative cancer, when ER negative, PR negative, HER2 negative, it is carcinoma. This carcinoma is very grave and fatal and is progressive and produces major mortality. Radiotherapy is performed prior to the surgery and even after the surgery to kill the cancer cells or the remaining cells which are left behind